A very good morning to one and all presence here. Today we are going to discuss about the very interesting topic, alcohol. So first of all, introduce myself. I'm Arul Selvam, Assistant Professor, Department of Pharmacology, Institution College of Pharmacy. So we are going to discuss one of the interesting topic for alcohol. So first of all, what is alcohol? So alcohol is aliphatic alcohols or hydroxyl group derivatives present in their hydrocarbons, aliphatic hydrocarbons. They contain one or more hydroxyl groups present in their hydrocarbon, aliphatic hydrocarbon. In that containing number of hydroxyl group, they are classified into the four categories. First one is monohydroxy. The name wise, monohydroxy means the one OH group present in the particular alcohol groups. Drug examples for that classification: ethyl alcohol and methyl alcohol and propyl alcohol. The second category is dihydroxy. So name is the dihydroxy means two hydroxyl group present in that particular alcohol. Drug example for that ethylene glycol, propylene glycol. And third category is trihydroxy. So trihydroxy, the name is the three hydroxy group present in that particular aliphatic hydrocarbon. Um, there is a drug example for the glycerol. So polyhydroxy means more than three or many hydroxy group present in the particular alcohol group. The drug example for that polyhydroxy mannitol and sorbitol. So there are so many of alcohol groups or so many alcohol groups are present there. So but only we are focusing on human consumption used for the only for common use for the drug ethyl alcohol. So ethyl alcohol, ethyl alcohol is a major component of the all type of alcoholic beverage. It is obtained by the sugar fermentation by yeast. It is separated by the simple distillation. Ethyl alcohol, the properties of the ethyl alcohol is a colorless and volatile and inflammable liquid. There is a the percentage of alcohol present in that they have contain alcohol group, so that they will classify into many of type. The natural, there is a neutral split. So there is neutral splits containing 90 to 95 percentage of alcohol by the volume. So wine, so many of that wines are containing a 60 percentage of alcohol by the volume. And the alcohol contents of various beverages is ratio of 4 to 55 the volume of alcohol. So stronger preparations, that is more amount of alcohol present in that group, that is called as a group split. So that split contain a 50 to 58 percentage of alcohol in that particular alcoholic beverages. So what are the mechanism involved that ethyl alcohol? So the ethyl alcohol is ethyl alcohol to bind with that calcium channels, calcium ion channel, to inhibit the influx of calcium ion through the calcium ion channels. It is also increases GABA induced synaptic inhibition and the antagonist the glutamate action. So that ethyl alcohol to increase that GABA induced synaptic inhibition, that is called as hyperpolarization produced by the cell membrane, and also produces the antagonist action of the glutamate neurotransmitter, so that they produce the action. So next move of the pharmacological action. In that alcohol, there is producing many of the pharmacological actions. There is a categorized by the two type. The first one is local action. So local action is a very simple one. That's locally we use that particular alcohol. Ethyl alcohol acts a mild rubefacients and counter irritant, and when that rubbed on the skin. So we are using that skin product. Some of the skin products contain a ethyl alcohol beverages that is not produce the mild rubefacients and the no counter-irritated effect to the produce the skin, so that it evaporates from the skin, leaving behind the cooling effects. So alcohol is astringent by the precipitate of the surface protein. They also produce as a antiseptic effect of effect by the participating by the bacterial protein. So that these are the actions for the locally we produce that healthy alcohol. And that systematic. So that systematic action is various systems involved in that they have produced the action. The first one is CNS. So CNS is a very common that we are taking alcohol beverages. They produce the at lower concentration, 30 to 100 microgram, 100 milligram per deciliter. They produce the anxiolytic effect and euphoria, excitation, and hesitation, and causes of worst. At the higher concentration, they have produced the mental cloudiness and disorganization of the thought and impairment of memory, atlasia and drowsiness occurs. So that we are taking a lower concentration, they have produced some mild effect, and that we are taking the higher concentration, they have produced the various CNS activity in that particular ethyl alcohol action. So that we are taking some alcohol that system CVS, that is a cardiovascular system. They produce a small amount of drug that produce the cutaneous vasodilation. So vasodilation, it means that blood vessels has been dilated to the um, dilated and the flushing. They have taken the moderate dose, that is a minimum dose, medium dose. They produce the tachycardia and a mild increase in the blood pressure. We are taking large dose. In that, we are taking a vasodilation due to the direct vascular smooth muscle dilatation and the vasomotor center depression. So next, move on to the next system, blood. The blood to moderate dose to increase the HDL level. So to increase the HDL levels means that the cholesterol level is good cholesterol level is increased, and the decrease the LDL level oxidations. So that we are focusing that responsible for the 15 to 35 percentage of lower incidence of coronary artery disease. So move on to next system of respiration. So that respiration, stimulation of the respiration by the irritation of pharyngeal and buccal mucosa. Central action depresses the respiratory center and respiratory depression. They moves to respiratory depression. So body temperature. We are taking alcohol, the body high dose, they depress the temperature, regulating the center to result the evaporates and skin by increasing the sweating. So move on for the GIT. So GIT, we are taking a drug for alcoholic beverages producing various effect on gastric secretion. So that we are taking a low doses, strongly stimulated to the gastric acid secretion. We are taking high doses that induce the inhibit the gastric secretion and causes of vomiting and mucosal congestion and gastritis. So next, move on for the next system for kidney. The diuresis occurs for after consuming of alcohol due to the water injected along with the kidney and alcohol induced inhibition of ADH secretion. So diuresis is a process to yeah, excess amount of urine volume is excreted by our body. So we are moving to the next section of the reproductive system, where the alcohol is a very sexual performance is impaired. Chronic alcoholism can lead to impotence and testicular atrophy. So that produce the infertility of the men or women also. Uterus. So that uterus alcohol produces the relaxation of uterine muscles of the contraction. So alcohol has various action to produce that particular area. So, what are the pharmacokinetic parameters involved in that action? Absorption. So, the rabbit is more absorbed by the small intestine in empty stomach. If food delays absorptions distribute to the throughout the body and cross the blood-brain barrier and placenta. The most of the alcohols is metabolized by the non-microzyl enzymes in liver, and remaining is excreted by the drug through kidney and lungs. So next, one of the ethanol poisoning. So we are consuming more amount of ethyl alcohol or methanol to take that our body. We are using some antidotes for ethanol poisoning. One of the drugs most commonly used for the drug disulfiram. So disulfirams prevent the oxidation of acetaldehyde formed by the alcohol metabolism. This is increases the acetaldehyde concentration in the blood, and this is a direct effect on the cardiovascular system. So disulfiram also inhibit the dopamine beta oxidase and the synthesis of noradrenaline and depleting catecholamines. So the flowchart of produce the ethanol is converted into the acetaldehyde. Then acetaldehyde is converted to the acetate. In the presence of ethanol to acetaldehyde, alcohol dehydrogenase in the presence of NADH to convert it into the NADH and acetaldehyde to acetate. Um, there is an enzyme involved in aldehyde dehydrogenase. First of all, there is acetaldehyde dehydrogenase involved in that process of NAD converted into NADH. So our drug disulfiram to block the enzyme aldehyde dehydrogenase, so that the conversion process will be blocked. So the pharmacological basis in for the current mechanism of the diet action of disulfiram. So pharmacokinetics, what the pharmacokinetics in the drugs we are taking our body, disulfiram gets slowly and incompletely absorbed by the gut and metabolized gradually by the urine and excreted by the urine. Adverse effects. There are so many adverse effects. Common adverse effects are there. So some of these common, very known effects: rashes, drowsiness, and dizziness, headache, cramps, and eruptions, urticaria. So these are the drugs can produce some of the adverse effect. Garlic-like or metallic taste in mouth. So we are continuously taking that disulfiram. There is a tasteless in our mouth. Mild GI disruptions and restlessness and drowsiness are produced by the peripheral neuropathy. So, what are the contraindications present in that uh, disulfiram taking? The disulfiram is contraindicated with the patients having a severe myocardial disease or coronary occlusions and severe hepatic impairments of the psychotic disorders. General anesthetics are paralyzed to produce the effect similar to the alcohol and should not be concurrently administered with the disulfiram. There are sometimes causes severe reactions such as falling blood pressure and even circulatory collapse. Corvin is a drugs having a similar properties and has a shorter duration of action. So these are the drugs. Some of the drugs examples are some of the drug examples are there. Mainly we are focusing to take that alcohol with general anesthetics and carbamides. So we are focusing the alcohol. The alcohol is a very commonly used beverage, alcoholic beverages in our human consumption. The alcohol is mainly used for the many of that drug products, drug product preparations, and as well as using some of the drugs beverages for the many formulation. Um, the disulfiram is one of the antidote for using for ethanol poisoning, so that we are using that drug. So in that we are conclude that session. We are move on that what is the alcohol. So we revise the topic of what is the alcohol and what are the classified the alcohol is there and what are the mechanism of action involved in that alcohol and what are the common pharmacological effects to produce that alcohol. Then move on of what is alcohol poisoning, where are the drugs used for that alcohol poisoning. We focusing on one of the main drug for the disulfiram itself. We are used for the methanol methanol ethanol ethanol poisoning. So what are the contraindications to produce the drug on our body? Okay, thank you.